You wake up on a Tuesday morning, make your tea, reach for the milk, and suddenly your left arm feels strange, almost numb for a moment. You blink twice, shake your hand a little, and just like that, the feeling comes back. So you shrug it off and carry on with your day. But what you just ignored could have been your body sending you a final warning before something far worse happens within the next 24 hours. A study tracking thousands of people across the UK found that nearly 1 in 5 strokes is preceded by a brief episode that most people dismiss. And the reason so many miss it is simple. The symptoms disappear, so they believe everything is fine when it absolutely is not fine at all. In this video, you will learn the 7 warning signs your body may send you before a stroke, including the one that disappears so fast people ignore it completely. You will discover why the NHS urges you to call 999 even if the symptoms vanish, and you will understand exactly what to do the moment you notice any of these signs. And the last one on this list will completely change the way you think about stroke warnings, because it is the one that saves lives but gets ignored the most. If this information could help someone in your family, please share this video with them right now. And if you find it useful, give it a thumbs up and subscribe to the channel. And I want to ask you this. Have you ever experienced a sudden symptom that disappeared quickly and you decided not to worry about it? Share your story in the comments below. A stroke happens when blood flow to part of your brain is interrupted, either by a blockage or a burst blood vessel, and brain cells begin to die within minutes. But here is what most people do not realize. Before a full stroke, your body sometimes sends a practice alarm called a transient ischemic attack, or TIA, often called a mini-stroke. During a TIA, a small clot temporarily blocks blood flow to your brain, causing stroke symptoms that disappear within minutes or hours. And most people think if it went away, it was not serious. But research tracking stroke patients across the UK shows that your risk of a full stroke is highest in the first few days after a TIA, with a significant number of strokes happening within the first 24 hours. The NHS created a simple tool to help you recognize these warning signs instantly, and it is called Fast Face Arms Speech Time, and it works for both full strokes and TIAs. Scientists have found that people who recognize these signs early and call 999 immediately have much better outcomes than those who wait or ignore the symptoms. And the best part is that you do not need medical training to spot these signs. You just need to know what to look for, and that is exactly what we are about to cover right now. So let's go through the 7 warning signs your body may send you before a stroke, starting with the most familiar and ending with the one that surprises everyone. Warning sign number 1, sudden drooping on one side of your face, especially when you try to smile. This happens because the part of your brain that controls the muscles in your face is not getting enough blood, so one side of your face stops responding properly. When you look in the mirror and try to smile, one side of your mouth may stay flat or droop downward, and your eye on that side might not close all the way. A study published by researchers tracking stroke patients found that facial drooping is one of the most reliable early signs of both stroke and TIA, yet many people think it is just fatigue or a dental issue. This sign is especially important for people over 55, because stroke risk increases significantly with age, and recognizing this early can mean the difference between full recovery and permanent disability. If you notice this happening, do not wait to see if it gets better. Do not splash water on your face hoping it will go away, and do not convince yourself it is nothing serious. Ask someone to look at your face or stand in front of a mirror and smile widely. Then raise both eyebrows and close both eyes tightly to check if both sides move the same way. If one side is not moving normally, even if you feel fine otherwise, this is a medical emergency, and you need to call 999 immediately, not in an hour, not after you finish what you are doing right now. The most common mistake people make is thinking that because they can still talk and walk, it must not be serious. But facial drooping alone is enough reason to get emergency help. And here is something critical. Do not drive yourself to the hospital, because your symptoms can worsen suddenly while you are behind the wheel, putting yourself and others in danger. The ambulance crew is trained to start treatment the moment they arrive, and hospitals prepare for stroke patients before they even walk through the door when they arrive by ambulance. Time is everything when it comes to stroke, because every minute that passes without treatment means more brain cells are dying, and that means more permanent damage to your speech, movement, or memory. So if you see your face drooping or someone else notices it, treat it as the urgent warning it is, not as something you will mention to your doctor next week. Remember, your brain is not like a cut on your finger that heals on its own. It needs immediate medical intervention to stop the damage before it becomes irreversible. Facial drooping is your body waving a red flag, and the only correct response is to call 999 without hesitation, even if you feel embarrassed or think you might be overreacting. Warning sign number 2, sudden weakness or numbness in one arm, one leg, or one entire side of your body. This happens because a specific area of your brain that controls movement is not receiving enough oxygen, so the signals from your brain to your muscles are interrupted or delayed. You might notice that one arm feels heavy and weak when you try to lift it, or one leg drags slightly when you walk, or you suddenly cannot grip objects properly with one hand. Research from stroke units across the UK shows that arm weakness is one of the most common early signs of both stroke and TIA, and it often appears suddenly without any obvious cause. This sign is particularly dangerous for people over 55 who live alone, because if you cannot use one arm or leg properly, simple tasks like getting dressed, opening a door, or even reaching for your phone become difficult or impossible. The NHS uses a simple test as part of the FAST tool. Raise both arms in front of you and hold them there for 10 seconds, and if one arm drifts downward or you cannot lift it at all, that is a clear warning sign. Do not convince yourself that it is just a pinched nerve, arthritis acting up, or muscle strain from yesterday's gardening, because true stroke-related weakness comes on suddenly, not gradually over days or weeks. If you notice sudden weakness or numbness on one side, even if it is mild and you can still move a little, call 999 immediately and do not wait to see if it improves. Many people make the mistake of lying down and resting, hoping the weakness will pass. But during a stroke or TIA, every minute without treatment increases the risk of permanent disability. While waiting for the ambulance, sit down safely so you do not fall if your symptoms worsen, and try to note exactly what time the weakness started, because that information helps doctors decide on the best treatment. Do not take aspirin or any medication unless the emergency operator specifically tells you to, because some strokes are caused by bleeding in the brain, and aspirin can make that type of stroke much worse. And here is something that surprises many people. Weakness from a TIA can disappear completely within minutes, but that does not mean you are out of danger. It actually means you are at very high risk of a full stroke in the next few hours or days. So even if your arm strength comes back while you are on the phone with 999, do not hang up and cancel the ambulance, because you still need emergency evaluation and treatment to prevent a major stroke. Your brain has just shown you that it is vulnerable, and ignoring that warning because the symptom disappeared is like ignoring smoke, because you do not see flames yet. Treat sudden weakness or numbness as the medical emergency it is, not as something you will monitor at home, because when it comes to stroke, waiting and watching is the most dangerous thing you can do. Warning sign number 3. Sudden slurred speech, difficulty speaking, or trouble understanding what others are saying to you. This happens because the language centers in your brain are not getting enough blood, so your ability to form words, pronounce them clearly, or understand speech becomes impaired. You might notice that your words come out jumbled or slurred, almost as if you have had too much to drink, or you might understand what you want to say but cannot make your mouth form the words correctly. A study tracking stroke patients found that speech problems are one of the most frightening early signs for both the person experiencing it and their family, because it happens suddenly and without warning. This sign is especially concerning for people over 55, because speech difficulties can also affect your ability to call for help, which is why it is so important that your family and friends know the warning signs too. The FAST tool includes a simple speech test. Try to repeat a simple sentence like "the sky is blue," or tell someone your full name and address. And if your words are slurred, mixed up, or you cannot speak at all, that is a stroke warning. Do not assume it is just fatigue, low blood sugar, or that you're having trouble concentrating, because stroke-related speech problems come on suddenly, not gradually after a long day. If you notice sudden speech difficulties in yourself or someone else, call 999 immediately, and if you are the one having trouble speaking, try to stay calm and use gestures to communicate that you need help. Many people delay calling for help because they feel embarrassed about slurred speech or think they will sound foolish on the phone. But emergency operators are trained to recognize stroke symptoms even if you cannot speak clearly. While waiting for the ambulance, do not eat or drink anything, because if you need emergency treatment at the hospital, having food or liquid in your stomach can complicate things or delay life-saving procedures. And here is a critical point. Speech problems from a TIA can disappear within minutes, and when they do, most people breathe a sigh of relief and decide not to bother calling for help after all. But that is exactly the wrong response, because your brain has just shown you that it is at serious risk. And the fact that your speech came back does not mean the danger has passed. Research shows that people who experience a TIA and do not seek immediate treatment have a much higher risk of a major stroke within the next few days compared to those who get emergency care right away. So even if your speech returns to normal while you are dialing 999, finish that call, because you need urgent medical evaluation to prevent a full stroke from happening in the hours or days ahead. Warning sign number 4. Sudden vision loss in one or both eyes, or sudden double vision that appears out of nowhere. This happens because the part of your brain that processes visual information is not getting enough blood, or because the blood vessels supplying your eyes are temporarily blocked. You might notice that your vision goes completely black in one eye, as if someone pulled a curtain down, or you might see two of everything when you try to focus on an object. Research from ophthalmology and stroke units shows that sudden vision changes are often overlooked as stroke warnings because people assume it is an eye problem, not a brain problem. This sign is particularly dangerous for people over 55 who already wear glasses or have age-related vision changes, because they may dismiss sudden vision loss as just another part of getting older. If you experience sudden vision loss or double vision, do not rub your eyes hoping it will clear up. Do not adjust your glasses thinking that will fix it, and do not wait to see if it improves on its own. Call 999 immediately, because vision problems related to stroke or TIA need urgent treatment, and delays can result in permanent vision loss or a major stroke within hours. While waiting for help, sit down in a safe place where you will not trip or fall if your vision worsens, and try to note exactly what time the vision problem started and which eye or eyes are affected. Do not attempt to drive yourself anywhere, even if you think you can manage with one eye, because your depth perception and peripheral vision are compromised and you could cause a serious accident. And here is something that catches people off guard. Vision loss from a TIA often resolves within minutes, and when it does, most people convince themselves it was nothing serious and carry on with their day. But temporary vision loss is actually one of the strongest predictors of an impending stroke, and ignoring it because your sight came back is like ignoring chest pain because it stopped when you sat down. The blood vessel that was blocked temporarily could block again at any moment, and next time it might not clear on its own, leaving you with permanent vision loss or brain damage. So even if your vision returns completely, you still need emergency medical evaluation, because doctors can identify the cause and start treatment to prevent a major stroke before it happens. Treat sudden vision changes as the urgent warning they are, not as a minor inconvenience you will mention at your next optician appointment. Warning sign number 5, sudden severe dizziness, loss of balance or difficulty walking, especially if it comes on without any obvious reason. This happens because the part of your brain that controls coordination and balance is not receiving enough blood, so your sense of where your body is in space becomes disrupted. You might feel like the room is spinning intensely, as if you just stepped off a carnival ride, or you might suddenly lose your balance and need to grab onto furniture or a wall to keep from falling. A study tracking stroke patients found that dizziness and balance problems are often misattributed to inner ear issues, low blood pressure or dehydration, which delays people from seeking emergency help. This sign is especially concerning for people over 55 because falls from sudden dizziness can result in serious injuries like hip fractures or head trauma on top of the stroke risk itself. If you experience sudden severe dizziness or loss of balance, do not lie down hoping it will pass. Do not assume it is vertigo or an ear infection, and do not try to walk it off or steady yourself and carry on. Call 999 immediately, because dizziness related to stroke or TIA is different from ordinary dizziness. It is sudden, severe, and often accompanied by other symptoms like nausea, vomiting, or difficulty focusing your eyes. While waiting for the ambulance, sit down on the floor or in a sturdy chair where you cannot fall, and try to stay as still as possible because moving your head can make the dizziness much worse. Do not eat or drink anything, even if you feel nauseous and think water might help, because if you need emergency treatment at the hospital, having an empty stomach is safer for certain procedures. And here is a mistake many people make. They assume that if the dizziness improves when they sit still, it must not be serious, so they decide to wait and see instead of calling for help. But dizziness from a TIA can come and go, and just because it eases when you are sitting does not mean your brain is getting the blood flow it needs. It just means you are not moving and making it worse. Research shows that people who experience sudden dizziness as part of a TIA and do not seek immediate treatment have a significantly higher risk of a major stroke within the next 72 hours. So even if your dizziness improves or disappears completely, you still need emergency medical evaluation, because the underlying problem, a blocked or narrowed blood vessel in your brain, is still there and still dangerous. Treat sudden severe dizziness as the medical emergency it is, not as something you will sleep off or mention to your doctor next week, because when it comes to stroke, every minute counts. Warning sign number 6, sudden confusion, trouble thinking clearly, or difficulty understanding where you are or what is happening around you. This happens because the parts of your brain responsible for memory, reasoning, and awareness are not getting enough oxygen, so your ability to process information becomes impaired. You might suddenly forget where you are, not recognize familiar people or places, struggle to follow a simple conversation, or feel like your thoughts are moving through thick fog. Research from neurology departments shows that sudden confusion is one of the most underreported stroke warning signs, because people often attribute it to tiredness, stress, or simply having a bad day. This sign is particularly dangerous for people over 55 who live alone, because if you are confused, you may not realize you need help, and you may not be able to call 999 or explain what is wrong. If you notice sudden confusion in yourself, Try to call for help immediately, even if you are not sure what is happening. And if you notice sudden confusion in someone else, do not leave them alone and call 999 right away. Do not assume it is dementia, delirium, or a medication side effect, especially if the confusion came on suddenly within minutes or hours, because that pattern is much more consistent with stroke or TIA than with other conditions. While waiting for the ambulance, stay with the person, keep them calm, and do not let them wander off or try to drive, because their judgment and decision-making are impaired and they could hurt themselves. Do not give them any medication, even if they ask for it, because you do not know what type of stroke they might be having, and some medications can make certain types of stroke much worse. And here is something that surprises many people. Confusion from a TIA can clear up completely within minutes, and when it does, the person often has no memory of being confused at all. But that does not mean the danger has passed. It means the brain was temporarily starved of oxygen, and the same thing could happen again at any moment, possibly with permanent consequences next time. Research shows that people who experience sudden confusion as part of a TIA and do not seek immediate treatment are at very high risk of a major stroke within the next few days. So even if the confusion resolves completely, emergency medical evaluation is still absolutely necessary, because doctors can identify the cause and start preventive treatment before a major stroke occurs. Treat sudden confusion as the urgent warning it is, not as a senior moment or a sign of normal aging, because when it comes to stroke, dismissing symptoms can be a fatal mistake. Warning sign number 7, and this is the most important one: stroke symptoms that appear suddenly and then disappear completely within minutes or hours. This is what doctors call a transient ischemic attack, or TIA, and it is the ultimate warning sign that a major stroke may be just hours or days away, yet most people ignore it completely. During a TIA, a blood clot temporarily blocks blood flow to part of your brain, causing stroke symptoms like facial drooping, arm weakness, slurred speech, vision loss, dizziness, or confusion. But then the clot dissolves or moves, and blood flow is restored. When the symptoms disappear, most people breathe a sigh of relief and convince themselves it was nothing serious, maybe just tiredness, stress, or low blood sugar, and they carry on with their day without calling for help. But here is what research shows. Nearly 1 in 5 people who have a TIA will have a full stroke within the next 3 months, and most of those strokes happen within the first 48 hours after the TIA. The NHS is absolutely clear on this point. If you experience stroke symptoms, even if they disappear within minutes, you must call 999 immediately, because a TIA is a medical emergency, not a false alarm. The reason this is so critical is that doctors can identify what caused your TIA and start treatment right away to prevent a major stroke, but only if you seek help immediately, not the next day or next week. Treatments like blood-thinning medication, blood pressure control, cholesterol management, or even surgery to clear blocked arteries can dramatically reduce your stroke risk, but they only work if you get them before the major stroke happens. So if you experience any stroke symptom, even if it lasts only 2 minutes and you feel completely fine afterward, call 999, do not drive yourself to the hospital, and do not wait to see if it happens again. And here is the mistake that costs lives. People think that if symptoms disappear, calling for help would be wasting everyone's time or making a fuss over nothing, but that could not be further from the truth. Emergency services and hospitals would much rather evaluate you for a TIA and find that you are okay than have you ignore it and come back days later with a major stroke that leaves you paralyzed or unable to speak. If you are over 55, you should also talk to your doctor about your stroke risk factors, including high blood pressure, diabetes, high cholesterol, atrial fibrillation, smoking, and family history of stroke. Many strokes can be prevented by managing these risk factors with medication, lifestyle changes, and regular monitoring, but only if you and your doctor know they are there and take action before a stroke happens. So remember, symptoms that disappear are not a sign that everything is fine. They are a sign that your brain is in danger and you need emergency medical help right now, not later. Here is exactly what to do the moment you notice any stroke warning sign, whether in yourself or someone else. First, memorize the FAST tool right now: face, arms, speech, time, and use it the instant you suspect a stroke or TIA. Second, call 999 immediately. Do not wait to see if symptoms improve. Do not call your GP surgery or a non-emergency number, and do not drive yourself or anyone else to the hospital, because the ambulance crew can start treatment on the way and alert the hospital so they are ready for you. Third, note the exact time the symptoms started, because that information is critical for doctors to decide which treatments are safe and effective for you. Fourth, while waiting for the ambulance, sit or lie down in a safe place where you cannot fall. Do not eat or drink anything, and do not take any medication unless the emergency operator tells you to. And fifth, even if your symptoms disappear completely while you are waiting, Do not cancel the ambulance because you still need urgent evaluation and treatment to prevent a major stroke in the hours or days ahead. Now, a word of caution. If you have certain medical conditions like bleeding disorders, or if you are taking blood-thinning medication, make sure the paramedics and doctors know that immediately, because it affects which treatments they can safely give you. And never stop or change your medication without talking to your doctor first, because that can increase your stroke risk even more. Imagine waking up tomorrow morning looking in the mirror and knowing with absolute confidence that if your face droops, your arm weakens, or your words slur, you will recognize it instantly and call 999 without hesitation, without doubt, and without wasting a single precious minute. If this video helped you understand the warning signs of stroke and TIA, please give it a thumbs up, share it with someone in your family who needs to see this, and check out the 2 recommended videos on your screen to keep learning about protecting your health. Your brain is the most precious thing you have, and now you know how to protect it when it needs you most. So stay safe, stay informed, and take care of yourself and the people you love.